Hi, Dr. Tim Clare with ProHealth Wellness Chiropractic in Charlotte, North Carolina, with Disc Centers of America, South Charlotte. We're talking today a little bit about the adjustment that we do in the office and what separates us from a lot of other doctors' offices. So we have our wonderful patient here that we're going to take care of, and you're going to actually see it because a lot of my patients have asked, why don't you put something on about how you treat and how you adjust? One of the things that we do for all of our manual patients is we actually get a measurement so we can actually see what's happening with their spine before we adjust. So we use the Pro Adjuster as a way to measure the spine and see what's actually happening. This actual procedure was developed originally, the technology behind this was developed by NASA. So it was a way that they could measure the outside of the space shuttle to make sure it would be safe for space. And from there, they could make sure that everything would go right during one of the flights. We can use the same technology where we're using sound waves to measure the spine and see what's happening as we're going through and adjusting. All right, we'll go to the other table. So I have my scans. I actually have the ability to see what's going on. And now I'm going to do the manual adjustment. And now I do a lot of different techniques in the office when I adjust. So there's a lot of ways to do it. This table allows me to open up the lower back. We can do a stretch on this into the lower back if we need to. We can do a rotational type of work as well if we needed to. There's a lot of different varieties in the way that we can adjust the spine, manually speaking. But you're going to kind of see a manual adjustment based off of what we found. So I'm going to be able to look over here and say, yes, sacrum and a couple of the other areas, see what I'm going to be working on. Relax your legs more. And then we're going to use a little bit of a drop technique to adjust. So this makes a lot of noise. And what I'm doing is I'm working on the pelvis to bring that back into a better position. And as we're going through, we're setting the spine to get motion put back into the joint and get pressure off the nervous system and get the muscles to relax, to get the body working better. And I can actually see, and I can correspond what I'm doing and what I'm feeling based off of the actual study that I just did. So the test gives me a very accurate way of measuring the spine, and that allows me to see what's going on. And then as I move through the different areas that I'm adjusting, I can take care of them, get it moving, and then we can go and retest at the end to make sure that we made a nice change. So we're going to go through and adjust a few more. Again, this technique uses physics. The force that we put into the spine, the table drops, and when the table stops moving, that point that I'm working on actually moves the vertebra. It gets the pressure taken off of that. We're going to get more up in here, but I'm going to do that a little different way. All right, you should turn on your side facing me this way. That's good. I'm going to put you right here. Hip towards me a little bit. I'm going to get that right aside. So this is the manual side posture adjustment. We're going in to adjust this area here. Relax for me. Good job. Go on your back. That moved pretty well. I'm going to get that upper thoracic. We're going to clean that one area that I adjusted just a little bit more here. Relax a little more. Good job. And then take a deep breath in. Let it all the way out. Good job. Now we're going to take a look at the cervical, and there were a couple of pretty rough areas in that upper cervical. So we're actually going to adjust up and through here too, right there, a little tender. And so I can feel it, but I can also see it. And so it gives me a real good and accurate picture of what's going on in here. Nice and relaxed. Relax your shoulder for me a little more. Good job. And then we're going to just clean up that upper one right there. Relax your right shoulder. Well done. Stretch. Cool. We'll go back to the other table, and we're going to take another look and see what type of change we made. So we're going to start up in the cervical spine, and I'm going to go back and I'm going to retest and see how we're doing. So same thing, I'm going to go back into the spine, and I'm just going to remeasure. Now, if you take a look at what I just did, this was our before graph, and this is the after graph. So this is our pre, and that's our post. And what you can see is from an adjusting standpoint, without even knowing everything that's going on in here, there's so much information here that I use to know what's getting done, how the patient's doing, how are they progressing. We can actually see that. And so I can actually use that as one of my determining factors of what's the patient's care plan like and how well are they improving and where are we going from there. So this is one of the ways that we can continue to take care of our patients the best that we do. I'm going to finish what I'm doing here and take care of her. I appreciate you spending some time with me and learning a little bit more about how I adjust. What you saw is a general type of adjustment. I'm also a sports doctor and a chiropractic physician. So I also do work on extremities, everything from shoulders, elbows, joints, like the wrists, the feet, the knees, the hips, anything else that we need to work on to get a patient really doing better. In my office, we believe it's your future and be there healthy. And we do that for a reason, because we want to take care of you. So thank you again for watching.